you guys have access. So at the end of the day, if you're using this, it's going to be more beneficial for you, I feel. But if you have access to UWorld, Kaplan, Bootcamp, use those as well. But this is more like one-stop shop. That's all. It just helps you gather your thoughts easier, right? So please, when you do that, this is the online platform, right? I have all the information here. And if you go down, I have more immunology points. Here you go, B cell and T cells and so on. So follow what I provide. Take your time. Basically figure out, there's a lot of information, but if I can learn 65, 75% of what Dr. Stavros is giving out for everything, you'll pass your test. That's why I do what I do. All right, cool. Okay, so question like this is scary, I think. Why? Because there's a picture, like, oh boy, there's a picture. I don't know what's going on. I got to figure out what this is. I don't know what's going on, right? I always advise my students, I'm advising you all, first things first, don't worry about the photo. Look at the scenario. That's my protocol. I always look at the scenario first. I see what they have to offer. I read the last 3 lines always. Part of doing well on any exam, especially USMLE, there's no other exam like it. I'm not tooting my horn. I'm just saying I don't like this exam. So I'm giving you guys an advantage and leverage to crush this exam, to not let the exam crush you, because it is crushable exam. It really is. I mean, they either can destroy you or you can destroy that and move on. It's a horrible test. I hate it. But I'm doing it purposely to show you guys how you can overcome a test-taking exam like this. Yes? Read the last 3 lines first. See what you can get. That's step 1. Step 2, read the whole exam, the whole clinical scenario after. So not only did you read the last 3 lines or 4 lines, if you got the answer, click and go. If you don't have the answer yet, read the whole scenario. Figure out what they're actually asking. Then look at the photo if necessary. That's it. So let's try it. Physical exam shows injected conjunctivae and tender erythematous nodules on both shins. Lungs are clear to auscultation. Okay, that tells me that it's not pneumonia, because if it was pneumonia, there'd be consolidation, right? Okay. Or mesothelioma or lung metastasis, you would see, I mean, because they're cleared. When you're hearing the lungs, it's cleared, right? An X-ray of the chest is shown, okay? So we have to look at it eventually. Which of the following additional finding is most likely in this patient? So what I'll do is I'll go to the top and read the first part and read the whole thing, actually. A previously healthy 30-year-old woman, stop. Right there, it tells us a lot. A previously healthy 30-year-old female, previously healthy, tells us what? Think about it. Think out loud. She's not immunocompromised. She's not immunosuppressed. That's pretty important to know. Many of you don't realize that, but you have to. It's like, well, 1 or 2 words can dictate your thought process. The person doesn't have cancer, doesn't have HIV, isn't sick, immunocompromised. She's pretty good. A previously healthy 30-year-old female comes to us because of a 3-month history of progressive shortness of breath and non-productive cough. Stop. So we have a previously healthy 30-year-old female, 3 months of shortness of breath, progressive, it's getting worse, and non-productive cough. Bro, respiratory is huge, isn't it? Because we're going to have either you producing phlegm, a productive cough, or non-productive cough. When you have a production of cough, like producing something, a productive cough, you have phlegm, right? You have sputum. Is it green? Is it clear? Is it yellow? Is it red? It tells you something. So just like I tell you, well, we have in the kidney, which we're doing tomorrow, we have nephritic and nephrotic. Is there blood in the urine? Is there frothiness in the urine? Same thing, right? It's one or the other. There's a massive swelling, little swelling. So respiratory is awesome because it tells us little things like this. So one doctor says sarcoidosis. Maybe we'll see. If that's what you think, let's see, right? So you have a previously healthy 30-year-old female, 3 months of progressive shortness of breath, horrible. She's not producing any phlegm. She has had constipation and fatigue during the same period. Okay? She has not traveled recently or been exposed to sick contacts. Why are they telling you that? To tell you that maybe it's not TB.